My name is Charlotte Pamani. I'm a consultant clinical radiologist from University College Hospital. I'm also a senior lecturer in cancer imaging at University College London. I'm interested in two tumour types, and they are prostate cancer and head and neck squamous cell cancer. The main problem in these tumours is that we are not able to predict, when we do imaging of patients with these tumours, whether a particular patient is likely to respond to radiotherapy. One of the predictors of response to radiotherapy is tumour oxygenation. Presently, we have no good non-invasive method for measuring this. This project is going to be looking at susceptibility mapping as a non-invasive marker of tumour oxygenation. If we can successfully develop this, we expect to be able to select those patients which are going to be responsive to radiotherapy from those which are not going to be responsive.
My name is Dr. Karin Shmueli, and I'm a lecturer in magnetic resonance imaging, MRI, here in the Department of Medical Physics and Bioengineering at UCL. I've developed techniques for a technique called tissue magnetic susceptibility mapping. This is an MRI technique that tells us about the composition and microstructure of tissues. This technique could be really useful to tell us about the oxygenation of blood and tissues because it tells us about a property of tissues called their magnetic susceptibility, which tells us how they behave in a magnetic field, just like the one we find inside our MRI scanners. So if we're able to measure blood oxygenation and tissue oxygenation using MRI tissue magnetic susceptibility mapping, then we might be able to measure the oxygenation of tumours, and this could help us predict treatment response in patients. So we're looking forward to developing susceptibility mapping techniques to help us in the clinical setting on data sets that we acquire in the hospital.